Obesity is the largest public health crisis facing Australia, with 63% of Australian adults classified as overweight or obese. 1 in 4 Australian children are now overweight or obese. Overweight and obesity is the second highest contributor to the burden of disease after dietary risks. Smoking is the third highest. These statistics highlight the lack of access to healthy food, and this is something that's manifest as a major problem in Australian society. Given the scale of the problem, it is something that warrants significant attention from our governments. The causes and forms of obesity are complex and varied, and the enabling factors include automobile dependence, poor access to affordable, nutritious foods, and a prevalence of calorie-dense fast food. However, the distribution of these factors is uneven, with those in the outer suburbs suffering disproportionately from overweight, obesity, and car dependence compared to their inner-city cousins. Those who are dependent on cars for transport are more likely to be overweight or obese. In addition, the outer suburbs of Melbourne have insufficient or inadequate social and health services. Melbourne is currently growing by around 100,000 people per annum, and approximately 75% of new Melburnians will be housed on the city's fringes. This new population is continually pushed out to areas where providing services at low densities is expensive and difficult. This observation highlights the urgent need for action to curb the incessant rise in obesity levels. In order to address these inequalities, governments must increase housing options within the inner areas of Melbourne, work to provide attractive and viable alternatives to the car by improving transport systems, and provide adequate levels of health services in disadvantaged areas. Further, governments can work to control retail planning in order to reduce access to unhealthy foods through the proliferation of fast food restaurants. Together, we can work to ensure that healthy food is available across Melbourne